Hello, everyone. Do you know where your medical records are stored? Think about how many times you visited your family doctor, or hospital, or had a blood test, or filled a prescription. Have you ever thought about how these medical records were stored and maintained, and what effect would they have on the healthcare that you receive? Perhaps in your past visit to a clinic or a hospital, you've seen your medical information being recorded in paper files and placed in a folder. However, nowadays, paper records are increasingly being replaced by electronic records. The computerized record, which summarize all the medical information in a patient's paper charts, are called electronic medical record, short for EMR. So why is this conversion necessary? Well, let's hear the story of James. James recently suffered an infection and visited a clinic. The doctor prescribed him with a medication to treat his infection. Here we refer to it as medication A. James then went to the pharmacy. When the pharmacist received his prescription with medication A written on it, she mistakenly recognized the name as medication B. This mistake is largely attributed to the illegible handwriting on the prescription. Say, for example, medication B can cause severe side effects, or James is allergic to an ingredient in it. The consequence can be life-endangering. However, medical errors that stem from illegible handwriting can be easily avoided if all medical data are recorded digitally. The clear benefits of electronic record is that the typeface is more or less standardized and clear across all records. If the clear advantage in legibility is not enough to convince you to place your vote in electronic records, let's do a more thorough comparison of paper records versus EMR in terms of four other functions. Firstly, storage and preservation. Paper records require ample storage space. Hospitals often have warehouses entirely for the purpose of storing paper files due to the ever-growing volumes of patients' records. No matter how well the storage environment is being controlled, paper records inevitably deteriorate over time and tend to decay upon excessive handling. EMR, on the other hand, takes up little physical space. Imagine your record, along with the records of thousands of other patients, can all be stored on computer drives, or even in the cloud. Secondly, searching. Searching for a piece of information in paper charts are very tedious. If all patients on a particular drug need to be contacted, the only way of finding this patient is literally to open every chart and check their medication list. However, electronic records can make this process so much easier because the clinicians can filter by the drug name in the computerized record system. Thirdly, analysis. If you're a patient who needs to get your blood pressure checked every week for a few months, it is very difficult to tell right away of how your blood pressure has changed over time, whether it has been constant or fluctuated through the several separate sheets of paper that record your numbers. But electronic records are smarter at helping clinicians to make sense of your information because digital data can be readily synthesized into graphs to make connections, reveal patterns, and relationships that are implied in your medical data. Now that you've learned all the benefits of EMR, let's uncover one thing that EMR is not very efficient at: sharing. EMR is an intra-office system that works within a single clinic practice. Say, for example, you end up in the ER needing for treatment, and you are unable to recall your medical history or whether you have any allergic reactions to any drug. This can potentially hinder the doctor's judgment on making the treatment plan that is most safe for you. The doctors won't have any information about you unless they request the medical record upon your written consent from your primary care physician. It must still be printed, mailed, or faxed to them, much like dealing with paper records. Although there is a limitation with EMR, we can see that its implementation can reduce medical errors and improve patient safety. Currently in Canada, EMR adoption rate among primary care physicians is at 85%, and it is on the rise. Thank you for watching.